because of all these immigrations we had there. So it's a great place to study this kind of this kind of questions, and we really hope to give some evidence that there are real differences in this group, so we can really try in the future to tackle these differences. So this is one of the contributions we expect that the brain bank in Brazil can have. Another contribution that we could do, it was very simple to do, but we only could do because we had this population in Brazil. I don't know if you are familiar with neuropathology of Alzheimer's disease. We have some ways to stage the pathology. One of the stage systems is called BRAC and BRAC, in which we look where the tangles, which are protein tau positive, are in the brain. And BRAC and BRAC describe it very well in 1991. This tangles starts in an area of the cortex called entorhinal cortex, and then they go to the hippocampus, and then they spread. And this is very important to know, because when we are thinking about prevention and drugs and treatment, we should concentrate in the first areas to be affected, because once the process is spread out, it's very difficult to do anything about it. And what we could show in Brazil, because we have so many control cases, that actually there is another area in the brain. It's called dorsal-raphe. It's actually in the midbrain, in this in the brain stem. Is this stem just below the brain? They show changes before the entorhinal cortex, and this was a very interesting finding for us, because in this area 80% of a neurotransmitter called serotonin is produced, and we know that lack of serotonin can lead to depression. And we know that many people who will manifest Alzheimer's disease a little bit later in life, they start having some mild depressive symptoms. And sometimes they go to the psychiatrist and they are treated for depression for 2 or 3 years, and then they convert. I mean, they start having cognitive impairment. And no one could explain before why it happens. I mean, maybe it is the person would realize that there was a memory loss there, kind of secondary symptoms, but it seems that it's part of the disease. And knowing this, we also can try to develop therapies for this kind of special depression that we see in elderly. Nowadays, one of the drugs we use for depression, it's the Prozac, for instance. I think you are familiar with this. What they do, they make the receptors that are supposed to receive the serotonin work better. But the problem is, if there is no serotonin, you can have as many receptors as you want. So maybe this is not the right drug for this kind of condition, and we should develop other kind of drugs for depression in elderly people who are in risk of having Alzheimer's disease. And this study, now it's being continued at UCSF, where we have more resources. It's a great university to perform kind of state-of-the-art methods to understand what is really happening in this area and how we can protect this area. So we are now applying proteomics and some very sophisticated measurement studies called stereology. And so this is a very nice outcome of these first studies who were descriptive, and we hope that we will take this information we are getting with the studies of ethnicity and apply the same approach. So now we can kind of narrow the scope and really apply more sophisticated methods, really hypothesis driven, that we really can try to get good results for it, not something that it's not useful in the future. So I think more or less it's what we are doing, and thank you for your attention.
Yeah, sure. So I'm just curious, and I've, you explained some of this to us when we met last fall. But so physically, you collected the tissue in Brazil.
Yes.
And you're here doing the work.
Yes.
So do you physically actually ship the tissue, or are you just transferring the data? People in Brazil are actually working with the tissue and sharing the data with you here.
It's a good question. The whole brain is processed in Brazil, and we make histological slides. So we cut it very thin slides, and then we stain. We do everything in Brazil, and then we ship the slides.
You ship the slides?
Yes.
Because when we were in your office, you had...
Half a brain in a case.
Yeah.
Half a brain per case or something like that.
You had a lot of them.
Yeah, I have. In my house, I have more.
You have to keep your son away from those.
Oh yes, it's very well protected. It was the first thing, because it comes and goes. And sometimes I work late in the night. I put my son in bed at 8 o'clock, and then I have my time, to work. And yeah, so I work. I have a microscope at home. It's a very time-consuming thing to do, but it's a pleasure.
And you said that you have submitted some of this for publication now.
Yes, the ethnicity.
The ethnicity data.
Yeah, we submitted 2 papers now. One showing that African Americans, they have less. They are more vulnerable to express Alzheimer's disease if they have the disease. But on the other hand, if they have vascular dementia, they are better protected. Yeah,
that's strange.
It's very interesting, actually. It was, and it's very robust data.
Robust.
Yeah. So we submitted it already. I don't know if it will be accepted or not. It has been submitted to the New England Journal of Medicine. And then we submitted another paper that is not directly related to Alzheimer's disease, but it was derived from this study, which is that we know that in Brazil, of course, the Portuguese, they were the first Caucasians to colonize the country. They killed all the Indians, of diseases. Well, everybody knows it's not a surprise. And then they stayed at the countries. But we know that most of the Portuguese who went there at the 16th century, they were new Christians. They were kind of fleeing from the Inquisition in Europe. Therefore, we know that probably the Semitic population in Brazil, although it's completely mixed, they are Christians, they are living spread out in the country, they probably have Semitic origin, but we couldn't study this in the past because although it was possible to distinguish between Caucasians and Africans, we couldn't distinguish between Caucasians from Europe and from Middle East. Now we can. So we submitted this population we study for this kind of studies, and we found out that indeed there is a very high Semitic component in the Brazilian population, but it comes from the father, not from the mother. And we could do that because we have some mitochondrial DNA that it's only passed through the mother. So in Brazilian history, we used to learn that the Portuguese, they were having children with the African women, but also the African men were having children with the African women. And in our studies, we based on these results, we are hypothesizing that actually the African men, they were not allowed to have intercourses with the women, only the white men. Because all this DNA coming from the father side in mixed Africans, Americans, and Africans in Brazil, they are coming from Caucasian origin, a lot of Semitic origin, not all of them, and not from African men. So it's just a result that it's related to the history of the country and how we see the colonization. It's nothing to do with Alzheimer's disease, but anyway. It's in the historical point of view, it's very important for the country to understand how was the colonization and so on.
That's
so we also submitted this paper, and for the ICAT this year, we submitted an abstract on this specifically Alzheimer's disease in Africans. And we didn't write a manuscript about this specific thing yet because we are waiting to complete the 507 cases. We will have it by August. And then it's better to write a manuscript with all the data. We have a better power analysis of the data.
That's great.
Correct.
Thinking about what you said about older people and depression and the lack of serotonin, I'm thinking a lot of older people probably go to a physician who then just prescribes something.
Exactly.
Thinking they're depressed, where it really could be a sign of maybe the fact that later they're going to develop Alzheimer's?
Well, not all of them, of course, but if
how would you know the difference between somebody who's just depressed and somebody who could be showing future signs of Alzheimer's?
I think we will be able to do it in the future if we improve imaging methods for looking at this structure called dorsal-raphe nucleus. The brainstem, this area of the brain, which is very important for our survival because our respiratory centers are there, and also our ability to eat and many other things are in the brainstem. But historically, especially after Darwin, this is a kind of historical thing. So Darwin proposed that the organisms, they evolve, and then the higher function organisms like humans, in a way, they are more important than the lower organisms. So let's put like this. So they use the same idea for the brain, and in the 19th century, people noticed that in humans, this upper part of the brain, the cortex, especially the frontal cortex, developed a lot compared to other mammals. So they applied the same idea, saying that these areas, they are responsible for higher functions. And the brainstem, although it's very important, it's the lower function. So this area commands the other area. And when the brain is not working very well, for instance in dementia, then the brainstem can take place. So this is the only time. It's not important. Nowadays, we are learning that this is not really like this, but there is a kind of interaction between both. There is no higher function and lower function. One can't work without the other, so they work as in circuits. But because we didn't know it in the past, all these imaging studies, even the most sophisticated ones, they were looking at the cortex, which is almost easier because they are in the surface and the brainstem is in the middle. But if we improve a little bit the way we look at the brainstem, we would be able to see if there are differences in the size of the nucleus, which will not happen in depression, but only in Alzheimer's disease. And if it's really true that this area is the first area to be affected, and now this study is being reproduced by Rush University because they have a very big collection of control brains, and the preliminary results shows that it will be true, but it's not published yet, so I can't say for 100% sure. Then we should really tackle to this area. So the person theoretically will come, and we will submit this person to a MRI, as we do anyway, but we will not look only to the cortex, we will look to the brainstem. And then the drug should be a little bit different than the drug we are giving now.
Thanks.
So it's not. It won't be very difficult. It's not invasive.
And what's the name of the thing we'd be looking at for?
It's called dorsal-raphe. Raphe is spelled R-A-F-H-E, nucleus.